My name is Muhamed Baljevic. I'm from Bosnia and Herzegovina. I received my medical degree with honors in research from Weill Cornell Medical College in Qatar, from where I proceeded on to complete my internship and residency training at Weill Cornell Medical College of Cornell University in New York. After that, I pursued fellowship training in Hematology and Medical Oncology, which I completed at University of Texas and the Anderson Cancer Center in Houston, Texas, where I also devoted part of my time in receiving additional training in clinical and translational sciences with specific focus of pursuing a career of clinical investigator in oncology. In my clinical practice, I focus on the care of multiple myeloma as well as the full spectrum of plasma cell dyscrasias, which are the disorders of plasma cells which are situated in the bone marrow. So that covers the full spectrum of malignant and pre-malignant conditions, including multiple myeloma, smoldering multiple myeloma, MGUS, as well as amyloidosis and Waldenstrom's microglobulinemia. To this extent, I also perform stem cell transplant for the patients that are candidates for stem cell transplant with some of these disorders. And I also spend a significant amount of time in being active in clinical arena, trying to develop new clinical trials for our patients and collaborating with many of our clinicians, clinical investigators, and basic scientists that we have. Early on in my education, I was oriented towards academic career and academic path, but it's perhaps the early exposures to basic science research and the bench research that allowed me a window into the hematology oncology field, which is really exceptionally dynamic. Here at Nebraska Medicine, Fred and Pamela Buffett Cancer Center and UNMC, we are focused on continuing the proud tradition of providing the excellence in innovation, in medical research, as well as clinical care that we offer to all our patients. And it is really this drive and multidisciplinary team and approach and collegial environment that we try to use to propel us to not just provide those treatments, but also participate ourselves in the innovation and in finding new treatment options, new ways of trying to improve outcomes for all our patients. Additionally, we also try to never forget that family is also an integral part of care for our patients, and we try to make sure that the patient and their family have a full understanding of a complete impact on their health and on the further steps that are ahead.